So this is the last lecture video on reproduction. This is part 5, and I will be talking about infertility and contraceptives in this video. Infertility is defined as the inability to conceive after 1 year of sexual intercourse without protection. The causes of infertility are usually split equally between males and females, and there's a lot of different causes of infertility, so I'm just going to go through a couple common causes of infertility in women and men. One thing that can cause infertility in women is a blocked uterine tube due to inflammation or scarring. If the uterine tube becomes blocked, it's going to prevent the sperm from being able to contact the egg, as well as it could prevent the fertilized egg from making its way down the uterine tube into the uterus to implant. Another thing that can cause infertility in women are complications associated with endometriosis. Remember, endometriosis is when some of the endometrial lining of the uterus actually escapes to areas outside the uterus. One other thing that can lead to infertility in women is ovulation disorders due to abnormal FSH or LH secretions. This can lead to irregular timing of ovulation, so it becomes harder to time when you're ovulating and when you're most likely to become pregnant. Let's look at some common causes of infertility in men. One of the most common causes of infertility in men are the production of anti-sperm antibodies. And so this is whenever the man's own body starts to attack his sperm. And this can occur because sperm usually don't come in contact with blood. However, if there's some sort of trauma to the testicles, then the sperm may come in contact with the blood, and this may actually trigger the body to start producing anti-sperm antibodies because they think the sperm are foreign cells. And so the body will start to attack the sperm, and that can lower the sperm count. There are many other things that can also lower sperm count, like lower levels of testosterone and so forth. So low sperm counts can also decrease the fertility in men. As well as morphologically abnormal sperm. So these are sperm that may not be able to swim as well when they get into the female's reproductive tract. And another common cause of infertility in men is impaired sperm delivery. So this could be due to things such as erectile dysfunction. So now let's look at the different types of contraceptive methods. And this can include behavioral methods, also barrier methods, chemicals, as well as surgical contraceptive methods. So let's look at the behavioral methods first. The first one is just abstinence, so refraining from sexual intercourse. Of course, this is going to be the only one that's 100% effective. Another behavioral method is called the rhythm method, and this is avoiding sexual intercourse around the time a woman is ovulating. And this has about a 25% fail rate. For my students, you do not have to memorize the fail rates. I'm just putting them on here for your information. However, in this case, with the rhythm method, what are some of the reasons why this might fail? Well, what an individual is trying to do here is they're trying to figure out when the female is ovulating and then trying to not have intercourse around that time. However, remember, sperm can live 3 to 5 days within the uterus. So if you have intercourse 5 days before you ovulate, it's still possible to become pregnant because there's still viable sperm that could be in the uterus at that time. And then another method is the withdrawal method. So this is removing the penis from the vagina before ejaculating, and this has a 19% fail rate, either because the penis isn't removed early enough, or there actually are some studies that show pre-ejaculate can have motile sperm in it. So let's look at some barrier methods. So these methods use physical barriers to prevent the sperm from actually reaching the egg. And sometimes chemicals are used in conjunction with barrier methods as well. So male and female condoms, these are placed over the penis or placed into the vagina before intercourse. They prevent the sperm from contacting the egg, and they have a fail rate of about 15%. The diaphragm, or also known as the cervical cap, actually gets inserted into the vagina, and it covers the cervix, which is the opening to the uterus. It's usually used in conjunction with spermicide, so spermicide will be placed on it as well to help, for one, to kill any sperm that may come in contact with it, and also to prevent any sperm from actually getting into the uterus. The fail rate for using the cervical cap or diaphragm is about 20%. Another contraceptive method that kind of could be seen as a barrier method or chemical method in a way is our intrauterine devices, or IUDs. IUDs are T-shaped plastic structures. This is showing the size of them. They are inserted into the uterus by a health professional, and they have a little string hanging out from the bottom of them. This string is helpful in when you want to remove the IUD, but it's also helpful in just making sure the IUD hasn't moved from its position where it's supposed to be. IUDs are extremely effective. They can last for up to 10 years, and they have a fail rate of only 1 to 2%. There's two major types of IUDs. There's hormonal IUDs. So these actually release a synthetic hormone called progestin, which is very similar to progesterone. And what it does is it actually prevents ovulation, and it alters the uterine lining to prevent fertilized eggs from implanting. So as long as you keep progesterone levels pretty high, it will inhibit the anterior pituitary. So maintaining high levels of progesterone or estrogen prevent LH from peaking, which would prevent ovulation from happening. Copper IUDs, they actually make the uterine environment very toxic to the sperm. So these don't release chemicals, but any sperm that come into the uterus will die because of the copper located on these IUDs. So let's look at some chemical methods of contraception. The most common one used are the oral contraceptives or the pill. Birth control pills usually come in about 28 pills, and they actually have a very low fail rate of about 0.1% if they're used consistently and used correctly. Usually, about 21 of these pills will contain synthetic progestin, again, which is similar to progesterone, and sometimes it will also contain estrogen as well. And then some of the pills will contain only sugar, and this could be anywhere from 4 to 7 of the pills would just be sugar. Now, how does this actually work? Well, again, the constant levels of progestin prevent ovulation because they inhibit LH secretion. So they prevent the peak in LH, so you don't ever ovulate any eggs. However, the high levels of progestin and estrogen do usually cause the uterine lining to proliferate. So you still do have thickening of the uterine lining. And then when you switch over to the sugar pills for those few days, it causes the progesterone levels to drop. And as we already learned before, progesterone levels, when they drop, it triggers menstruation. So this is why you can still menstruate when you're on the pill. However, you aren't ovulating. So since you're not ovulating an egg, you can't become pregnant. There's other ways to also inhibit LH, the peak in LH, which triggers ovulation. One is just to use a patch that's consistently giving you estrogen and progestin. Also, some people will get progestin injected or implanted inside of them to prevent ovulation. Another thing I just want to point out here is the morning after pill. This is also a contraceptive method in that it prevents pregnancy. If it's taken within 72 hours after intercourse, it can prevent or delay ovulation. And in addition to that, it will irritate the uterus to prevent implantation from happening. So it prevents implantation from happening at all so that the embryo can't develop if fertilization did occur. And then the last two things we're going to look at are the surgical methods of contraception. These are usually permanent, but there have been rare cases where for some reason they fail and somehow somebody becomes pregnant even after getting these procedures done. So in women, the surgical method of contraception is called tubal ligation. And this is whenever the uterine tubes are actually cut and tied off. So remember, the uterine tubes are how the egg travels to the uterus, or how the oocyte travels to the uterus. Fertilization usually happens out here. So if you cut this, you can either band it, cauterize it, tie and cut it off, or clip it. But if you block the uterine tube, somehow the sperm can never reach the eggs. And so fertilization can't happen. The surgical method in males is called a vasectomy. And this is whenever the ductus or vas deferens are cut and tied off. So here are the vas deferens. So remember, sperm are produced in the testes. They mature in the epididymis here, these tubes here. And then whenever during ejaculation, they move out through the vas deferens, and then they eventually reach the urethra and then exit the penis. However, if you cut the vas deferens and tie them off, then the sperm cannot travel outside the body. And so he can still produce semen, but there will be no sperm within the semen. The semen is actually produced by several glands, the prostate gland being a significant source of that, and the seminal vesicle glands would produce the semen. And that's the end of this last video on reproduction. If you have any questions on any of the videos, please comment below and I will try to address those questions.